Hi, this is Dr. Brian Castelein with Brighton Foot and Ankle, and in this video we're going to overview one of my favorite procedures to fix a bunion, the Lapidus procedure. The Lapidus procedure gets a lot of notoriety, especially with some of the common companies helping us perform this procedure, like Trace Medical and the Lapiplasty. There's so much advertising going on about the Lapiplasty, but what is this procedure? Well, the Lapiplasty is a newer, updated version of a very old historic procedure called the Lapidus. The Lapidus was developed in even the 1930s. It was 1931 when this guy named Dr. Paul Lapidus established the procedure, and then he formally published the procedure in 1934. Pretty cool to come up with a new thing and to name it after yourself. Well, what he developed is in our foot and where our bunion is, we have these long bones called metatarsals, and this first metatarsal comes off the inside portion of the foot, and the big toe gets pulled over here. But we know that this joint here at the base of the first metatarsal can move too much, and it shifts, and as this slides over, we get this big bunion. So what Paul Lapidus came up with was fusing this joint. Now that may sound terrible, but this joint should only move 1 or 2 degrees in our normal foot. So if we take a joint that should move 1 or 2 degrees and turn it to 0, I promise you don't miss that motion at all in there. But what happened with the Lapidus procedure, as Dr. Lapidus wrote, is there were some complications. Sometimes this joint didn't fuse very well. Other times there was recurrence. So thankfully, 80 years later, we have some updates to the procedure. And this is where we get our 3D bunion correction or our 4D bunion correction. And what that means is we're trying to come back here, still fusing this joint. This is the first tarsal metatarsal joint again. We're looking to fuse that joint and we're looking to stabilize it. Our current research shows that when this joint should have 3 little sections to the joint, 3 little facets that prevent the joint from moving too much. When you have all 3 of those little areas, there's a 1% chance that you're going to get a bunion. When you have just 2 of the 3, well, now we're looking at a 19% chance that you're going to have a bunion. When you only have 1 and this joint can move extra and way more motion, well, that's when we get the other 80% of bunions only have 1 little area onto this joint. So that instability needs to be corrected with a fusion. Thankfully too, we also understand that as this metatarsal slides off the inside, it not only opens up like a peace sign, but it also rotates. So that's where we're getting now our 3D bunion correction, where we're fixing that rotation. We're getting these small little bones called the sesamoids underneath the bunion, and we're stabilizing the whole complex back and through here. This now allows us to have a recurrence rate of like 5% or even less. Thankfully in our practice we take a lot of time, we take a lot of diligence with this, and I don't think we quite see those things here. That's compared to other bunion procedures where you can have 15 to 25% recurrence rate. So stabilizing the foot, providing long-term correction, that's the other great thing about the Lapidus, is once we fuse this joint back here, it's not going anywhere. There's no bunion that's going to come back for us. When we're doing this procedure, we're doing it at a hospital or surgery center. We're doing this outpatient, so you are able to go home. My post-op protocol involves letting you walk sometime between initially right after surgery up to 2 or 3 weeks after the surgery. We're going to be walking in a boot for 6 to 8 weeks. We're going to allow this joint to fuse and for these 2 bones to become 1 bone and that stability there. Then after that period in the surgical boot, we're going to get you into your shoes and get you ramping up your lifestyle and get you back into your normal activities after that 8-week mark. Once you're transitioning into your tennis shoes and getting back into your daily life, then we're going to get you back into your running, into your activities, wearing your more casual shoes. A full process of this procedure can take somewhere between 2 and 3 months to get you feeling really pretty adequate and back into your normal life. But again, the perks for this is we're getting a very long-term correction. We're getting a very stable correction to this area. We're not going to have that recurrence rate of a bunion, and you're going to be much happier.